Moving to healthcare news. If you find these explanations helpful, don't forget to like this video and subscribe for more updates. Our next story delves into a policy decision affecting millions of Americans struggling with obesity. The federal government has decided not to move forward with a proposal to have Medicare cover new weight loss medications. Under President Biden, officials had floated adding obesity drugs to Medicare's covered benefits, a move that would have been a game-changer for older Americans. But the Centers for Medicare and Medicaid Services, CMS, it will not implement that plan, effectively denying coverage for popular weight loss injections like Wegovy and others. The drugs in question, such as Novo Nordisk's Wegovy and Eli Lilly's Zepbound, are part of a new class of GLP-1 agonist medications. They've made headlines for their remarkable ability to reduce body weight by up to 20% in clinical trials and help prevent type 2 diabetes. Given America's obesity epidemic, many experts saw them as a potentially revolutionary tool. However, there's a big catch. They are extremely expensive, often around $1,000 per month without insurance. For many patients, especially seniors on fixed incomes, that price puts these drugs out of reach. Biden's team had proposed that Medicare, which insures Americans over 65 and those with disabilities, begin covering these anti-obesity medications. The idea was to enable more Americans to afford these new treatments, reasoning that helping people lose weight could save money in the long run by preventing costly diseases like diabetes and heart condition. It was a bold proposal because traditionally Medicare has been prohibited from covering most weight loss drugs by law, a ban dating back to when such drugs were seen as lifestyle medications of dubious value. Now, the Trump administration's CMS has quietly shelved that proposal. In a brief statement Friday, the agency said it did not move forward with the Medicare obesity drug coverage plan. They provided little detail on the rationale. But analysts point to the potential cost to Medicare as a likely factor. If even a fraction of Medicare's 65 million beneficiaries started using these $1,000 a month injections, it could add tens of billions in new spending annually. The previous administration argued that enabling coverage would remove cost barriers for a drug class that could improve health. The current administration appears more skeptical, possibly viewing it as an untenable financial burden on the program. The stock market reacted swiftly to the news. Shares of Novo Nordisk and Eli Lilly dipped once investors learned Medicare won't be footing the bill. That's because the decision significantly limits the market for these drugs. Medicare beneficiaries make up a huge portion of people who might benefit from weight loss medications. As obesity is common among older adults and often exacerbates other health issues, without Medicare coverage, many of those seniors will either have to pay out of pocket or go without. Some private insurance plans do cover these drugs, but coverage is patchy and often comes with strict criteria. Healthcare advocates are divided. Obesity advocates and many doctors are disappointed. They argue that obesity is a disease, not a cosmetic issue, and should be treated with the same urgency as, say, cancer or rheumatoid arthritis, for which Medicare does cover expensive drugs. For them, CMS's reversal is a setback that denies seniors access to effective treatment and perpetuates the view of obesity treatment as optional. They also note potential long-term savings. A successful weight loss could mean fewer joint replacements, fewer diabetes cases, and lower overall Medicare costs down the road. On the other hand, those worried about Medicare's solvency are relieved. The program's hospital insurance trust fund is already projected to face shortfalls in coming years. Adding a massive new class of drug spending might accelerate financial problems. Some health economists also caution that these new medications, while promising, are still being studied for long-term effects. They argue it might be prudent to wait until there's more data on outcomes and perhaps until competition or volume brings prices down. It's worth noting that the Trump administration hasn't explicitly slammed the door forever. CMS could revisit the issue, especially if pressured by Congress or if drug makers decide to lower prices or offer deals. But for now, the agency's stance aligns with a general conservative approach to health spending. Be wary of expanding entitlements. This mirrors other moves by the Trump health team, such as tightening Medicaid eligibility and promoting private Medicare Advantage plans. From the patient's perspective, nothing changes, which is exactly the issue. Take a 70-year-old with obesity and related heart problems. They heard the buzz about these new injections. Maybe their doctor even recommended trying one. But without insurance, it's unaffordable. Medicare saying no means that patients still likely won't get the drug unless they are wealthy or can find a clinical trial or special coupon program. It also means weight loss clinics and doctors won't be reimbursed by Medicare for these treatments, possibly slowing how quickly these therapies integrate into standard care for the elderly. This decision underscores the broader debate in American healthcare: how to handle breakthrough but expensive treatments. In this case, the treatment is for a chronic condition that affects 40% of adults. The Biden administration took an aggressive stance that tackling obesity was worth the cost, akin to investing in a long-term health benefit. The Trump administration appears to be prioritizing cost containment and a wait-and-see approach. We should also consider the public health messaging. The previous administration, by proposing coverage, effectively said obesity is a medical issue deserving treatment. Backing off, that could be seen as sending a mixed message to patients. Will doctors be less likely to prescribe these drugs if they know Medicare won't pay? Possibly, since many patients simply can't pay themselves. Alternatively, we might see pressure build from the public. If enough seniors lobby and share success stories of weight loss on these drugs, Congress could intervene. In fact, there's already proposed bipartisan legislation, the Treat and Reduce Obesity Act, that would allow Medicare to cover DEA-approved weight management medications. That effort may get renewed focus now. In conclusion, Medicare will not start covering costly weight loss medications like Wegovy, a reversal of a Biden-era plan. It's a decision with significant implications. Drug companies lose a huge potential customer base. Many seniors will have to forgo a new form of treatment, and the U.S. grapples once again with the trade-off between medical innovation and budget reality. For now, weight loss shots remain a luxury that Medicare beneficiaries must pay for out of pocket, keeping these game-changing drugs out of reach for many who might benefit from them.